Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We want to welcome you to another episode of the MGMA Insights podcast, and we're joined by a returning guest, Dr. Robert Pearl. Robert Pearl is a renowned physician, executive, podcaster, author, and just about anything else. He's just a tremendous thought leader in healthcare, and we appreciate him coming back on the show. He's going to be here talking about his latest book, ChatGPT MD, How AI-Empowered Patients and Doctors Can Take Back Control of American Medicine. Dr. Pearl, welcome back to the show.
Daniel, it's great to be back with you.
Yeah, so I had to do a little research. I knew we had you on the show. I couldn't quite remember when that was. And then I found it. It was April 2020. We were just in the wake of the pandemic, and we had you on. You were a keynote speaker at one of our MGMA events, which we had to switch to a virtual event. And I wanted to just catch up with you here. What's been going on the last 4 years in your life?
The last 4 years have been very exciting. Obviously, there was the COVID pandemic, which was tragic during the transition. But since then, the world has reopened up. And I have a new book called ChatGPT MD, How AI-Empowered Patients and Doctors Can Take Back Control of American Medicine. It's number one now on Amazon's best new books list. All profits go to Doctors Without Borders. And it's very exciting to me about this next generative AI era of medicine and how it can both help patients and improve the doctor-patient relationship.
That is so exciting. I have a lot of questions for you about that. So let's just start at the very beginning of it. What spurred the idea of the book, and how'd you put it together?
As you know, Daniel, I've been interested in figuring out how we can transform American medicine to move it forward to achieve value-based care, quality, convenient access, and affordability all at once, doing that in the context of improving satisfaction for both the providers of care and the recipients. And this is an idea that's not new. You can trace it back actually in 1932 when the CCMC, the Committee for the Control of Medical Costs, released its findings. But why hasn't it happened in nearly 100 years, despite the work of MGMA and despite the urging of individuals like myself? And I think it's that we haven't had the tool. We've known that medical groups could accomplish more than individuals. We've known that technology could help, but we haven't had the modern technology. And then all of a sudden, 2 years ago, OpenAI releases ChatGPT. Now, I want to be very clear for listeners that AI is a word we use for a variety of different types, rule-based, narrow, and now generative. But they're all very, very different. And the generative AI is now a tool that I believe can make the difference by empowering patients, by being able to not just treat disease, but help to improve health. And that's the way, through higher quality, fewer heart attacks, fewer strokes, all the things that we know are possible to be able to raise that quality, improve life expectancy, and make care more affordable.
So you have been involved in healthcare in different ways for decades. You were the CEO of the Permanente Group, I believe, for 18 years. You have been at the cutting edge of a lot of things going on in healthcare. Where did that spark come from? You didn't just go to med school and, become a doctor and treat patients, but you did all of that in an amazing way. But then you kind of kicked things over. You kind of turned over every rock. You looked outside of the way things are done, because they've always been done that way. You hear that a lot in healthcare, and that's not who you are. So where did this spark come from?
I think a lot of it is serendipity. I think all clinicians want to make patients better. You're absolutely right that Most doctors go to medical school, the very narrow focus on how do you accomplish that. And I was one of those doctors, and I loved clinical medicine. In fact, the hardest job of my getting into a leadership role was that I knew I would have to at least cut back a little bit on the clinical practice that I was able to do. It was not a desire, it was actually a limitation of moving into a leadership role. But I did my residency. I went to medical school at Yale, did my residency at Stanford, and I was going to, my focus was on cleft lip and cleft palate. And I'm a plastic reconstructive surgeon and ways to improve the procedure for children. I was going to go to South America to fix kids with cleft lip and cleft palate. I've done quite a number of mission trips there in the past, love them very much. And about 6 months before I graduated, the plastic surgeon at Kaiser Santa Clara died in a tragic accident. They called me up and said, Robbie, would you come over and give us a hand for a little while till we can find a full-time replacement? And I said, sure, why not? You know, there was nothing much to lose in doing so. And I loved it there. And my first year being there, I was asked to become chairman of the operating room committee. Now, I assumed it was because my pedigree was so powerful, because people recognized how smart I was, how well trained I was. No, everyone else had turned it down. I was just a new kid on the block who was dumb enough to say yes. But I got into the role, and I found a way to be able to improve the operating room. We had a shortage of nurses at the time, and we found ways to do a training program and found ways to bring in traveling nurses. And we were able to reverse the problems. And I actually enjoyed that. And I could see the impact that it had, both on the clinicians providing the care and on the patients. And if you do well in one job, usually people will find other jobs for you. And then across time, I took on more and more responsibility. I became the head of the facility in Santa Clara that takes care of 500,000 people. And then the opening happened for the CEO role. And it wasn't something I really wanted to do. I asked a variety of other people, would they do it? I'd support them in their efforts. Because at the time, Kaiser Permanente was in big trouble. It was down to 2 days of cash. Kaiser Permanente, the Permanente being half the delivery side of the healthcare system, along with the Kaiser insurance. There was major problems, major losses. And as I said, they had to borrow a day of cash to stay in business. But again, getting into the role, I enjoyed it. So that's been the trajectory. I've actually learned to like leadership. It wasn't something I craved, but it was something I found very rewarding.
Yeah. When did this fascination with the intersection of technology and healthcare come about?
My background in technology, I actually went to high school, where I learned at the time to program computers and had summer jobs working in a variety of businesses, helping them both to be able to do the things they were doing manually, to do them using technology. And I've always been impressed that this was the leveraging factor. You know, you look at something going way back to the 13th century, the Gutenberg printing press, how it would take something that would be done manually by one individual for years, and all of a sudden you could put out hundreds or thousands of copies of a book, similar to the one I'm doing right now, in a matter of hours, days, depending upon the particulars of the circumstance that existed. So I can see it there. You look at the tractor. We had 70% of Americans as farmers, and the tractor is able to do the work of about 100 humans and be able to allow individuals to expand in new directions. We certainly have seen this with computers, the internet. And so this has been a ever progressive way. And in medicine, we have the model now, really has been around for centuries. And it was a model that was designed to take care of people with acute disease, with pneumonia, with appendicitis, problems that were amenable to a single doctor and a single patient, problems that would usually get better after the appendix was taken out or the antibiotics were administered. And now we're facing a very different world where we're seeing chronic disease. We're seeing patients having to come in 3 to 4 times a year for the rest of their life. And we don't have a system that allows that to be able to be done in a way to facilitate individuals, particularly in primary care, to be able to complete the work that needs to happen in the time that's there. And when I look at that, I'd say, okay, how are you going to solve it? You can't solve it by getting people to run faster on the treadmill. You
Right.
can't solve it. You don't want to solve it by skimping on care. There aren't easy, good models. Technology has often been the solution, but we haven't had it until now. And generative AI, I call it ChatGPT in the book, now provides that. And I believe can allow not only better health and better outcomes, but be able to decrease the demands on the clinicians providing the care.
That is wonderful. Thank you for all the work you've been doing there. And as far as the book itself, what was ChatGPT's role in writing about ChatGPT and how it can help healthcare? Talk about this partnership.
Yeah, so I actually, after having written two previous books that were bestsellers, I wasn't yet ready to write another book. And in particular, I worried when it came to writing something about a generative AI technology that if I followed the typical process of an author and a publisher, that it would take 2 years. That's the usual time frame between the writing of the book and all the other processing and the printing and distribution that had to sit in place. And I said to myself, at the rate that this technology is advancing, what would happen over the course of those 2 years? And for listeners and viewers, we're talking about exponential growth. This is a technology that's doubling in power, doubling in capability every 12 months. And that means, by the way, that by 5 years, it'll be 30 times more powerful than today. It's like a car that will be better, that will be able to go faster than an airplane 5 years from now. You'd say that's impossible. And yet that's the trajectory not only that we have been on, but is projected to go ahead and continue into the future. And I realized that by 2 years, anything that I wrote would be out of date. Mm-hmm. So here I faced a circumstance. How could I create a book that was as good as the previous ones that I had written in a time frame that had to be 6 months? I knew I could shorten the printing part of the process by using Amazon, an online tool that could be moved from concept to implementation in a matter of days. But how can I speed up the writing without compromising the excellence that I prided myself on in my previous two books? And I decided to do it with ChatGPT. I thought it'd be a great example of how this tool can be applied. You know, one of the things about many of the technologies of the past is they advanced information, the internet, the iPhone. You can get a huge ream of information available to you very, very quickly. With each of these, you click on links, you get information, but you don't have expertise. You don't know what to do about it. And what impressed me about generative AI was its ability to provide that expertise. You've never had an art class and you can paint like Rembrandt or Van Gogh. You've never programmed a computer. Now you can do so, even though you've never taken a course in information technology. You can write a song in the style of Drake, as was done, even though you don't play an instrument. And I could see how this technology created an expertise to be able to allow an individual to now actually make a diagnosis and manage chronic disease. And if you can make a diagnosis, you can get better care 24/7, taking work away from the physician, not loading more work on. If you can get expertise, you don't go there with a lot of links at a Google Doc and being able to ask clinicians a variety of questions for which they don't have the time. You can actually ask the technology to provide the information that then allows you to have the conversation. And most importantly, you can manage your chronic disease every day rather than doing it on a 3 to 4 month basis. I couldn't see a different way to solve the challenges both that I faced as an author and medicine faced without bringing in this new technology. What was it like? I'd say it was not that dissimilar to writing with another human. Most of it was very positive and rewarding. It gave me tremendous information. It facilitated the process. I did leave one chapter that ChatGPT wrote 90% of, so readers could experience that. I clearly labeled it. Most of the chapters, I'd say I wrote the majority, but they all were assisted. There were difficulties. Downloading, I began the process by downloading the 1.2 million words that I had written in the past. And that was a process that you could imagine took a lot of time because you could only at that time download 25,000 words at each sitting. However, now 6 months later, you can do it much more rapidly. And I had to double check everything ChatGPT said. At one point, as an example, it came up with a story about the exploration of the North Pole and the relationship to leadership, none of which actually existed. And I had to cut that out of the text and to note it into the book itself.
So you noticed a little of the hallucination with ChatGPT that's talked about?
Yes, there was a hallucination, and some of the verb tenses weren't as good as they needed to be. But I would say that 80%, 90% was really good. And there were times that I couldn't find research that I wanted to be able to locate. And ChatGPT found it for me, provided the references. And so again, as in any partnership, it's not perfect, but it was clearly very rewarding and allowed me to accomplish what I needed to do. And I'd say the same thing's going to be true in medicine. And for listeners, I want to stress what exists today, which is GPT-4, isn't yet ready to be used by patients without clinician oversight. I'm talking about the future generations, this exponential growth, 30 times more powerful being in play. And so I say right now it was similar to the book writing, which is that it required a human to be able to separate fact and fiction. But I'm optimistic that once it continues to improve, and I don't mean way in the future, I'm talking about in the next 2 to 4 years, because I'm already seeing and hearing stories from clinicians who are using it and testing it and how accurate they think it is. And let me add one more piece if I could, Daniel, which is that we as humans have a bias that is pro people and away from machines. We want the machine to be perfect, and we overlook all the problems that currently exist. We know that 400,000 people die annually as a consequence of misdiagnosis. We know 250,000 people die from medical errors. We know that there's a huge number of heart attacks and strokes and kidney failure that can be prevented by better management of blood pressure and better management of diabetes. We know diabetes is well managed less than half of the time, blood pressure only 55% of the time. And yet we ignore some of these failures and shortcomings, and we hold technology to a higher standard. What I would say is you have to ask, is this technology better than existed otherwise? And my experience, both in writing the book and in its application to medicine, is this technology offers a wonderful potential to accomplish both. Maybe it won't eliminate all misdiagnoses, but how about if it cut it in half? 200,000 lives saved. Maybe it wouldn't save all 250,000 people with a medical error, but what about if it cut it by a quarter? So you had 60,000 fewer people who were dying. I think that would be a wonderful place to begin.
You talked about the creation of the book. If somebody's considering buying it, give them the sales pitch. What can they learn from the book? And do they need to be in healthcare? Is it for everybody? Tell us about that.
So the book, which is, as I say, currently available through Amazon, is for both the providers of care and the recipients. Okay. For the clinician, and let me even back up a tiny bit from there, which is that the success over time is going to require that partnership. It's not going to erode the doctor-patient relationship. I think it's going to not only improve it, but it's going to evolve it. And it's going to require that both doctors and patients have a more active role using this technology. For clinicians, what does it do? It allows you to find diagnoses. I tell the story in the book about a surgeon who found herself in the operating room having done a very complex neck surgery. She knew it went perfectly well, and yet the patient was having problems. The vocal cords were pulled together in the middle, which can happen after you damage a nerve, but she knew she hadn't damaged a nerve. What was going on? If the patient was just discharged home, they could have a breathing problem, they could asphyxiate and die, not be able to take in oxygen. And so she looked to ChatGPT and it found a case report of exactly the same thing. And it was found that in some patients, the local anesthetic migrates farther faster than it otherwise would in most individuals. And that if you wait 30 minutes, that will wear off. And that's exactly what happened. Rather than admitting the patient to the ICU or doing a tracheostomy, she was able to wait 30 minutes and the patient went home with a complete recovery. So for clinicians, it allows information to be found. And I mentioned earlier the misdiagnoses. It's a second opinion. We often would like to get a second opinion, but it's hard to do because our colleagues are so busy. Here's the opportunity to check ourselves or find the most up-to-date information. Remember, the medical literature advances. It doubles in size every 72 days. Who can keep up with that? Technology can. So the clinician, I think, has a lot of uses. But the more important part, I think, is the application. And it's why I put the subtitle, The Empowerment of the Patient, and put the patient ahead of the physician in the subtitle. The opportunity to be able to empower the patient to get that expertise. Now, why is that so important? Well, it's so important for the patient because the truth is that most of the time it's hard to get the medical advice that we need. Let's just say it's 11 o'clock at night. Your child has a fever. You don't know what to do. Do you go to the ER where you're going to wait for an hour or two surrounded by people coughing with infectious disease? Or do you wait till the morning? But you're afraid. Could this be meningitis? Your child could die. You call the doctor's office. What do you get? A recorded information, a general one for all patients. Go to the emergency room. That's not specific to you. You call the answering service. They say the doctor will call you back in the morning, but the morning could be too late. You now can put all of that information into a generative AI tool, and you can find out the best advice. Is it going to be perfect? Probably. It will occasionally have a problem, but is what we have today more problematic? I think yes, because the patient is left to figure it out him or herself 2/3 of the time, on nights and on weekends. But more importantly is what I said earlier about chronic disease. We don't do a very good job of taking care of chronic disease, and these are the most common causes of heart attacks, strokes, kidney failure. The challenges of longevity. The US life expectancy now is no better than in 2010. It's not that we don't know anymore. It's not that we're not motivated. We just haven't had the tool to help the patient. Now we have that tool. And so that ability to have the patient better manage their chronic disease. And why do I emphasize that? Besides the quality and the affordability, because of physician burnout. We know that 60% of doctors are burned out. Why is that? Because they're being asked to do more than humanly possible. Data says it would take 27 hours for the primary care doctor to do everything that was recommended. Not possible. And what that means is at the end of the day, the clinician goes home feeling they haven't done as good as they could have done, not because they didn't want to, but because they didn't have the time. If the patient can stay healthier and can better manage their own chronic disease by connecting generative AI to wearable devices and being able to get updates all of the time and when necessary to be able to ask for improvements and changes in treatment and medication, this would be a remarkable outcome and improvement that would not only improve the health of patients and make care more affordable, but also diminish demand on clinicians, free up the time that they need to engage in conversations with the patients who do come in at deeper levels. I think this would be a remarkable improvement and restore the mission and purpose that leads individuals to choose medicine for their career.
You have shared several really interesting anecdotes and stories, case studies from the medical field in this book. What's your favorite one that really touches on unlocking data, how generative AI can unlock data, and why that's so important in healthcare right now?
I think I'll say my favorite story, not in the book. I actually had it on our podcast earlier this week. I was talking to a podcast host like yourself, and she was telling me this story about her husband. This was after the podcast. We were just
Hmm.
talking. And she said, my husband had a ski accident. She knew I was a skier. 2 months ago, he was coming down a slope and he slipped and his arm was over his head and he fell. And his shoulder is still not what it needs to be. What do you think? And I said, I'll tell you what. I think I know what's wrong, but I'm not going to tell you. I want you to put all the information into ChatGPT, and I want you to tell me about the diagnosis and the treatment recommendations. And she said, okay, I'm not even sure she had it. I think she may have had to download it at that time. And she put all the information in, and then she sent me an email and she said, I can't believe it. It made the right diagnosis. It told me the specific diagnostic test he need. He told me that it probably needs surgery. If it had not been for this information, it might have been too late for him to get the repair that he needed. He's now seen an orthopedic surgeon who confirmed exactly what ChatGPT said, and surgery is now scheduled. That is so different than what exists in medicine today. The helplessness that the typical patient feels and those providing the care, no matter how educated, smart, intellectual, dedicated they might be, when you face a patient like that and you could have done a great job, but the patient didn't come to you because they didn't know that that was the right thing to do. That to me is the story of the future of what can happen when clinicians who are dedicated and patients who are empowered work together with technology as one.
I think I have at least one more question for you. And this is one I think it's fair to say you have been a vocal critic of healthcare systems because we had you on the podcast and you were showing a lot of the challenges that healthcare systems have, not the people, the hardworking people in there, but some of the broken systems in there. So if we look at that through the lens of ChatGPT, what can it do to help solve some of these major challenges and problems that you've been talking about for a long time now?
I write a lot and think a lot about a variety of chicken and egg type problems in healthcare where every time you recognize a problem, the problem is another problem, and how do you put the pieces together? And if you ask me, what do I see as the biggest limitation of this technology? I would be very, very clear with a one-word answer: humans.
Hmm.
That, I think, is the problem. Will we embrace it or will we reject it? And part of embracing it is to recognize that if the technology accomplishes what I believe it can, which is to keep people healthier, to diminish the need for care, what's that going to do in the transactional fee-for-service world of American medicine today? It's going to cut into income, and that will not happen. So a second change that has to happen in parallel is moving from fee-for-service to, call it prepayment, call it pay for value. I like the word capitation, a group of clinicians taking care of a population of patients with a set fee. Because now suddenly, when the patient doesn't get the heart attack, they get the benefit. Obviously, their lives are saved and they don't have the discomfort and pain of having to have a procedure done. But right now, the doctor or clinician gets penalized, as opposed to in a situation of a capitation where they get rewarded because they're paid a set fee. And if the patient doesn't get the heart attack, then they get the economic benefit. And why has capitation, which has been talked about now for almost 100 years, as I mentioned earlier in the show, not happened? Because we haven't had the tool to make it successful. So we're looking at, again, this chicken and egg situation. Capitation is seen as being the right direction for value-based care, but you can't do it unless you have a technology, because then the economics are bad. And you're not going to do the technology unless you have the economic shift. And now we have the opportunity to do all of those pieces. And so I'm, again, optimistic. Future generations, ChatGPT, that will be out soon, we're talking in the 3 to 5 year range, are going to have this ability to lower the cost of care, allow care to be shifted from transactional to a pay for value type mechanism, focusing on prevention. And I believe that that will be better both for the health of patients and the American healthcare system. And if people want more information, they can find it on my website, Robert Pearl, MD.
All right. As you take us out of the show here, remind us again where our listeners can access and purchase the book, and what's one last takeaway you want them to get from ChatGPT MD?
They can get the book on Amazon, and I want them to recognize that now is the time to learn, to try, to develop the ability to put in place what's called prompts, to be able to use this technology in the future when it becomes 30 times more powerful to improve their health, to improve their life, and to make American medicine once again the best in the world.
All right. Dr. Pearl, it's so good to connect with you again, and thank you for doing this work.
My pleasure. Thank you for having me, Daniel.
All right. Thanks to all of you for being MGMA Insights podcast listeners.